important emergency COVID meeting that will take place today and tomorrow at the Secretariat, where Tamil Nadu Chief Minister Edappadi K. Palaniswamy, Deputy Chief Minister O. Paneerselvam, Tamil Nadu's Health Minister, Education Minister and Health Secretary will be in this meeting, which will also have several health experts and several other important experts who will be also opining their views. This important and emergency COVID meeting will be taking place to see what will be the next step of action that the state will take now that the total number of new COVID cases has almost reached 8,000. The state has already imposed several restrictions for the public from not venturing outside in a chance to curb the COVID rise yet again.
Karnataka had witnessed the highest spike of COVID cases in second wave. More than 11,000 cases was reported from the state of Karnataka, out of which more than 8,000 cases were seen in the city Bengaluru. We are here in city market in Bengaluru, where people are returning to the capital city after celebrating Yugadi from last 2 to 3 days. You can see the rush over here. There are large number of people who are coming back to city, and we are here in city market trying to do a reality check whether people are following all the COVID protocols which has been instructed by the government. We can see here there are street vendors here who are selling garlands, who are selling flowers, fruits, vegetables, everything on this particular street. But none of them are wearing masks. These are the people who sell all these fruits, vegetables, flowers to the customers, whoever comes every single hour on this particular street. But none of them have taken any kind of precautionary measures like wearing masks. Few of them, after seeing the video camera, after reporting here, trying to pull out their mask which is below their chin on their nose, just to avoid the media attention or the camera attention. Even the police and the BVMP marshals who have been deployed in and around in this particular area are least bothered to go ahead and find these people who were supposed to find people who are not wearing the mask. But they are least bothered about the vendors and other people who are visiting city market, where everybody is happily violating the COVID protocols in the city.
COVID situation is tense day by day, but the COVID norms violation is actually very normal on the ground. And in fact, people are actually not following the wearing masks, sanitization and social distancing. They don't care about the rise in cases and the second spike, and even the nation is worried about the situation. But the people who are actually roaming in the markets, they are not having serious concern about it. Just because you can see that how the people have no social distancing, wearing mask is not very much mandatory and priority for them. They are just concentrating on their work, and in fact this is not in their mind that COVID infection can be spread anytime by their contacts, and even social distancing is the need of the hour. Only two things to be followed on the ground in the markets, just to wear the mask and in fact to maintain the social distancing, but nothing has been happening. That is the reason the cases are being increasing every day. Number of cases are being reported positive. This is the Sector 26 vegetable market, where you can see that the people who are the vegetable vendors and even who are the customers, they are not maintaining social distancing, not wearing mask, even they are not concerned about it. Every day's picture. This is every day's picture, not even a single day. This is every day's picture, every single day. The same visible photographs and the people with the same attitude is very much visible. Even the administration is getting strict. They are imposing the fines without mask, and even also strictly followed to be social distancing, but nothing is happening on the ground. That is the reason the COVID infection is being spread every day, and even number of cases are being reported. This is the worrisome situation for the entire nation, but the people have to understand about it. And even the social distancing, maintaining single social distancing can halt this exercise, can put a stop on these spreading cases here on ground. And in fact, the administration should keep a regular check on this, so that the people should realize the seriousness of this COVID situation. Every day number of cases, even the Haryana has reached to the top of their COVID cases. Even 398 cases have been reported till date, and even in last 24 hours with 18 deaths. This is the highest number of single day spike in the Haryana, and even the Punjab is also reaching in, and even the Chandigarh is also concerned about the rising cases, that everyday number of cases are rising, and even now they are taking care of the beds also, just because the people are not able to understand the situation of the COVID, that how much it is tense, how much it is serious. The administration on the other hand is preparing for the beds of COVID beds and COVID hospitals, COVID centers, isolation centers, just because the people are getting infected of this COVID-19 cases, and even the inoculation is being done on the other side. But the point is that people are not able to understand. That is the reason that the situation is getting tense every day.
India today has recorded over 2 lakh COVID-19 cases. It's an unprecedented tally that India never saw ever since the pandemic broke. We are reporting from Max Saket Hospital. It is one of the facilities that has been designated by the Delhi government to treat only COVID-19 patients. But now what we have to see is that are people following the COVID-19 rules? Now that would be a negative, because even in front of a hospital where the chances of getting COVID, a hospital which is treating only and only COVID patients, we see no social distancing whatsoever. Now, one of the major reasons of the outbreak of coronavirus is that people are not following the social distancing norms. And this is the picture we're getting you right outside a COVID-19 facility, Max Saket Hospital, where only and only COVID patients are being treated. Looking at this situation in Saket area of the national capital, we see that how people here are not following social distancing, not properly wearing masks. This is the situation in a country which is recording around 2 lakh cases, and in past week has crossed the mark of 1 million cases. And looking at this situation here, we see that people are not following the COVID-19 protocols, which are just 3 very easy protocols, that is sanitization, wearing mask and practicing social distancing. All steps are being taken by the government. Multiple meetings are being held. Chief Minister Arvind Kejriwal today will be meeting the Lieutenant Governor, but at the same time it becomes the moral responsibility of the common masses to make sure and do their bit to flatten the curve.
The second wave of COVID continues to strike the state of Kerala, and it has become a matter of concern for the state, as in the last 24 hours, 8,778 cases were recorded in the state. What is most concerning is the high test positivity number, which stands at around 13.45%, the highest recorded since November 7th last year, when COVID was at its peak in the state. In the last 24 hours, there were 22 deaths recorded in the state, and thus the total death rate is now told at 4,836. Now the state health department and the officials are highly concerned about what is happening, as there is a big chance for these numbers to spike up in the coming weeks. Also, there has been restrictions placed on trading and all the shops, and they are supposed to be closed by 9 p.m. as per the government order. And today the Chief Minister has called a high-level meeting, which includes the Health Minister, the DMOs, the police officials, as well as district collectors. And in this meeting, more restrictions and curbs will be discussed. Now, what we also begin to understand that the trade union people are completely annoyed with the government and imposing certain restrictions on the trade, as they are now saying the politicians never went forward with ensuring that there was during the political rallies there was no COVID protocols that were put in place. So why that only the trade unions are being targeted? All this has come forward. Now the state is grappling under the COVID crisis, and so it is a matter of concern. And the second wave of COVID today, 11 a.m. there's an online high-level meeting convened by the Chief Minister, and more restrictions and more protocols will be put in place today.
Coronavirus cases are on continuous spike in the Union Territory of Jammu and Kashmir, but we as people are failing, we as society are failing to abide by all the norms, and that is leading to the continuous spike in the coronavirus cases. Here are some people who are not abiding by the COVID-19 norms. They have put up masks, but that is for the show purpose only. Sir, आपसे जानना चाहूँगा, मास्क ज़रूरी है?
हाँ जी,
तो फिर लगाया क्यों नहीं?
लगाया हुआ है।
नहीं, वो नाक से नीचे रख के उसका क्या फ़ायदा?
पता क्या, चलो हो जाता होगा, थोड़ा यार नीचे भी हो जाता है।
आपको लगता है लगाना चाहिए?
हाँ।
So they are admitting that they should wear mask, and if you see this way as well, there are many people who are without mask. I'll request Gaurav to show you the visuals. That way only the people have now started looking for their masks, because we have made a new habit that we will put up masks only and only when someone will ask us, or some police or some other person will. भाई साहब, आपको लगता है मास्क पहनना ज़रूरी है?
बिल्कुल सर, ज़रूरी है।
आप नहीं पहन रहे थे?
सर सॉरी सर,
मतलब ये मानते हैं कि ज़रूरी है, पहनना चाहिए अपनी सेफ्टी?
पहनना चाहिए।
So at least they are admitting that it is important to wear mask. I request Gaurav to show that way only. Some people, they are now started looking for mask as well. Sir, आपको लगता है कि मास्क जो है वो हमें पहनना चाहिए? हाँ सर, लगता है पहनना चाहिए? तो आप क्यों नहीं पहन रहे थे? So this is the kind of situation here, and this is not specific to Jammu only. This has become a new norm. We have seen that the people not abiding by the COVID norms, and that has led to an increase in number of coronavirus cases. Because if we speak of Union Territory of Jammu and Kashmir, there are around 1,000 cases on daily basis. And keeping in view the health infrastructure of the Union Territory of Jammu and Kashmir, it is kind of creating a burden on the health infrastructure. Even the government authorities are claiming that we are not short of any stocks, but the situation is grim here in the Union Territory of Jammu and Kashmir, and the people need to follow the COVID-19 norms seriously. With Gaurav Sahani, Gursimran Singh for Republic Media Network.